Research findings from the Human Sciences Research Council shows that certain age demographics in South Africa, particularly those aged 50 to 54, are experiencing the highest prevalence of HIV. This revelation prompted strong reactions on social media platforms, where many South Africans attributed the situation to the presence of sugar daddies and sugar mommies. Let's unpack this further with Dr Keitumetse Tumi Mashego, who's a clinical psychologist and also an author and a life coach. Dr. Tumi, thank you so much for your time and for joining us this evening. Now, what role does the relationship dynamics between older men and younger girls play in driving the transmission of HIV within this demographic group? And how can understanding of these dynamics inform targeted interventions such as education programs and just some behavioral change initiatives to reduce the risk and promote safer practices?
Good evening, and thank you for having me. You know, what is happening in society regarding this relationship is an indication of the state of our society. You know, we are in a crisis state in that what is happening now is reflective of the adults of today, but also the youth, you know, because they are the ones being infected. So we need to understand that these type of relationships are a power play and exchange of power, in that the people who have the money or the means are the ones who want the power to actually control over the youth or the ones who don't have. And in this relationship, they're very transactional. And unfortunately, people who are in power in this relationship tend to have all sorts of things that they are projecting, their own fantasies around this. Therefore, condom use, for example, is not a priority. Therefore, that's why then the HIV risk will be so elevated in these type of relationships. And people are nowadays, you know, functioning from a place of immediate gratification. And I think that's where, you know, these relationships are selling a lifestyle in a society where there's so much unemployment, so much people who are impoverished, there's so much poverty going on, and so much inequality that sometimes this type of relationship seems like a lifeline for people who are going through the most.
You speak of the poverty and the impoverishedness that exists within certain communities. I mean, the study was done across all the 5 districts in the Gauteng province, and the Sidibeng province was the highest in terms of the HIV prevalence at a 13.2%. How much of those kind of dynamics are at play, and are we seeing these transmissions from the older age group of 50 to 54 to the younger girls, or is it the other way around? Are we finding that they are probably having unprotected sex with young girls who were already born with HIV and AIDS?
You know, it can be either way, but I think what we need to understand is that some people, the viral load is undetectable. So there's also those dynamics as well at play. And certain people have access to medication or, you know, ways to curb the disease. But you have those also who do not have that access. And that's where then you get, you know, the manifestation of the illness in its extreme circumstances where it's presenting physically, where people are getting sick. So people with power, they tend to have the money to get access to, you know, medication or health interventions when they do present with physical illnesses, whereby those who are from a place of lack tend to then not have access to this. And unfortunately, then when they present, it's so severe or so far along the process that even the interventions do not help, the physical interventions. So I think what your question, just to going back to your question, is that I think it goes both ways, in that, yes, some are born with it, but actually some actually contract it, unfortunately, due to the circumstances we find our society in.
One of the key challenges or just the misconceptions that older men may face in seeking HIV testing and treatment and some support services, and how can healthcare providers and community organizations work in order to address these barriers and promote greater awareness?
Just overall, you know, HIV still has the stigma that people feel like they're not at risk to have it, or there's a lot of denial around it, or, you know, there's a lot of myths around it as well. So unfortunately, you know, with these type of transactional relationships, you do get health and moral risk, in that, you know, HIV is at an increased rate because of, you know, the regularity of the partners, but also just the people not using protection when they are having having intercourse. So it is very sad, the condition that we find ourselves in. But yes, there is, there's still a lot of stigma, unfortunately, around a lot of health conditions out there, including HIV and AIDS. And it's not just HIV and AIDS, but it's also just, generally people become so much in denial, or there's so much stigma, around certain diseases, physical and mental health challenges, that, society really, we need to do better in terms of educating people, but also making it accessible to everyone, because I think the health system is also overburdened or overloaded, in that there is not enough resources, including the professionals themselves, to help the physical and the mental health challenges that society faces.
On the issue of education, Dr. Tumi, I mean, the study reveals that 70% of individuals over the age of 15 say that they've never or sometimes used a condom with their most recent sexual partner. There was once a time where it seemed as though South Africa was over-educating when it came to HIV and AIDS. And in the absence of the power dynamics and the transactional sex that you spoke of earlier on, do we find that we've put the foot off the pedal in ensuring that we educate, that even young people who would find themselves in transactional situations such as these would at least advocate for the use of a condom?
The use of the condom is, or protection of any sort, or, sticking to one partner, is also so complex, in that intimacy itself is such a personal choice, but also there's other factors that play a role. For example, substance use. So you find that people find themselves in situations where they are intoxicated with all different types of drugs. Therefore, they're unable to really make a decision when in that state, when it comes to intimacy or use of protection, when it comes to intercourse. So we also need to bear in mind, the circumstances under which the act actually happens, in that sometimes it's not a choice, sometimes it's a forced sexual act, with rape. There's all sorts of situations where people don't really have a choice in that moment, and unfortunately it can have severe consequences. So you also find that the most educated, meaning the people who are aware of the disease, who know about it, still are the ones who are infected by it, because of that deniability when it comes to infection, and also just some of these circumstances that we've mentioned, such as, people wanting a certain lifestyle. Also, people always, projecting their own needs for a relationship. And if someone comes and offers this relationship, they find themselves, almost conceding to having such sexual acts without protection, even though they're aware of the risk. So I think we also need to do the work to help people become more self-aware of whatever it is that they need to, process in terms of their own traumas, and functioning from a place of lack. So if you're functioning from a place of lack, for example, where you feel like you lack a relationship, and whoever offers that relationship, no matter the circumstances, you almost give in to that relationship. I think that's where the education also needs to happen, because people are projecting their own needs, and therefore that's why these transactional relationships will always carry on, because people are just not doing okay. They're functioning from a place of lack or pain or traumas, or absence of, not getting the help that they need to become self-aware.
You spoke of an overburdened health system. There are government initiatives that have been in place for many years, trying to give that education that you speak of. How much of an onus ends and starts and ends with the home, within the family? Are we doing enough in speaking to our young ones and educating them and just making them aware of the consequences of such actions?
I think even the adults themselves, still need, to do the work within, so that they're comfortable with having such conversations. But we do find that in the home, that these conversations are not held. But when they are held, there's still limitations in that, the child or even the adult in that home still makes their own decisions. But, there's still so much chaos in terms of the family dynamics, in that, you still get things like your incest, whereby there's family secrets around sexuality that often lead, to people projecting such things when they, enter society, or when they interact in their relationships, where they make such poor choices because of the traumas that they experience in their families. So we really, as society, as individuals, need to do the work to see what it is that we need to deal with, so that we understand how we interact with other people. because the traumas we carry will determine how we relate with other people. Even the people in power who are in these transactional relationships, they're projecting their own inferiority sometimes because they're coming from a place of lack, where maybe, for example, this is just an example, of course, there's always the exception to the rule. They might be coming from a place where they never had the money, and once they have the money, it gives them the illusion of power and control, and they use that to overpower the partners in this type of relationships, whereby then we see, the situations that we see playing out where they target the most vulnerable, the young or the youth, to get what it is that they want. And, in that state where they're functioning from a place of inferiority complex, then they have many partners. And that's where the risk of transmission comes into play, these relationships.
Right. I know as countries, we may differ in terms of micro and macroeconomic situations that countries face on a day-to-day basis, but are there countries that we could benchmark against in terms of how they deal with some of these social ills in curbing some of the spreading of HIV and AIDS?
South Africa's history is so unique to South Africa in that, we came from apartheid, where people were seen or deemed as inferior, and some as superior. And then the pendulum swung to the other end. And I'm of view that we never really came to find balance. So I'm of view that what we see in society is actually just the playing out of this, the extreme reaction to coming out of where we come from, because there was never intervention when we came from, the severe apartheid system. So we never really got intervention. We just, for example, reversed the power, and that did not come with the things that we needed: support systems, support groups, for lack of a better word, to come to terms with what has transpired, so that when we give the people who were deemed less inferior the power, that they are able to actually manage that power. So we find ourselves in a state where this is playing out in that we are getting people who were deemed to have no power, who have access to power, who can misuse it. And of course, this is the exception to the rule. And then that's where it transpires into the relationships that we see, the transactional relationships, but also when we expect them to come up with decisions that make sense. I think it's almost setting them towards failure, in that we cannot expect it to come naturally without some form of support or intervention, or for them to process the trauma that they're coming from. So it really is sad what we're seeing playing out in that, we never got the support we needed when we, after 1994, I'm of view anyway. And, that's why we're seeing what we're seeing now happen. And it will take a while before it comes back to some form of balance where we're able to actually do the work within, be okay with, the things that are playing out, and actually, focus on the bigger systemic challenges instead of being so self-focused sometimes.
And lastly, Doc, looking forward, what would you say are the implications of this 32.2% HIV hike, especially amongst this age group of 50 and 54 in Gauteng, for the public health strategies and just the policy development and the community-based initiatives that are aimed at reducing HIV transmission, in improving healthcare outcomes and just fostering greater awareness of resilience within the population?
I think we still have a long way to go, sadly, based on these stats, in that, as I said now, what is playing out is this, the challenges that we have within ourselves that are, being manifested in how we interact in society, and the challenges that we face currently. So there's still a long way to go, in that we still need to do the work as individuals, to make sure that we're in a place where we are okay within our skin, so that we can thrive and actually just focus on developing other people and just society in general. So we really still need to do a lot of work in curbing, the spread of HIV, and also just understanding the risks, because people always think that it will not happen to me until it happens to me. And then when it does happen to them, there's so much denial, and that can, cause the disease to actually develop into, secondary infections, which then become lethal sometimes, to the people who are infected. So we really still need to do a lot of education in, promoting the people out there who are infected to start doing the work within, and to actually accept and to take responsibility for their lives. But in terms of government and society, we still have a long way to go in terms of curbing the spread of all these challenges that we face as society, in terms of the illness, but also even mental health challenges that come with the illness.